Good morning, it's Dr. Garrett, and today I want to go over digestion and nutrition and kind of give you an idea of how this plays an integral role in your body and why you are getting sick as often as you are. So let's go ahead and get started. Today's lecture, we're going to talk about the GI symptoms, those big five. And if you remember from our adrenal lecture, those big five are the same big five. We're going to talk about what GI warning signs are. What are these symptoms? We're going to talk about nutrition overview, pathogens. I have a case study for you to look at, and we're going to talk about how to heal, which is ultimately the most important goal here. So within the GI system, whenever it's under duress or having some issues, we start getting disease or we're starting to feel worse. And some of these core symptoms are the same across all aspects. You may have acid reflux. You may have diarrhea, constipation, bloating, gas, cramping, and nausea. A lot of times these symptoms are clustered into something. So you may go to a primary care doctor or into a little clinic and you're like, I'm having bouts of diarrhea, and then I'll have constipation, I'm getting a lot of nausea, acid reflux, I have a lot of gas and bloating. Typically the first thing that they say is you have IBS, which is just a big old bucket that they throw all the symptoms in and they never get to the root cause. Now we have medications that will make these things a little more tolerable, but the problem is over time these symptoms become worse and worse and worse, and then you're needing more medications, and then every medication that you take, you're going to have a side effect and you'll need another medication to fix it. So when we're looking at these core GI symptoms, it's important to keep in mind we need to get to the root cause. And remember with functional medicine, the tree branches and the leaves, those are our symptoms. That's our nausea, our cramping, our diarrhea, our constipation. We have the trunk of the tree, which is coming down through the organs of digestion. So pancreas, gallbladder, stomach, small intestine, large intestine, and then we're coming into the roots. What caused this to begin with? And that's what we're looking at. We want to find the root cause in functional medicine. We need to look at those antecedents, those triggers, those mediators, figure out what happened early on in life that got you to this point. Now, our approach is actually fairly simple. The first thing we want to do is truly get you in here and talk to you, whether that's through a telehealth video conference or here in the office. We need to find out what symptoms you're having. I need to be able to paint that picture of who you are and what's been going on in your life. After that, I need to do some lab testing on you. Now, sometimes that lab testing is as simple as doing what I call basic labs, which are not basic. I'm looking at a CBC, so I'm looking at your blood chemistries. I'm looking at a CMP, which looks at the different organs within your body, from your pancreas to your liver to your stomach acids to how you're breaking down proteins to your parathyroid. Sometimes I'm adding in some IgG panels or food allergy panels. And these are looking at allergies that aren't swell your throat shut, break out in a rash the minute you eat it. These are looking at food intolerances, things that have been leaking by and getting into your bloodstream via leaky gut and have been causing autoimmune reactions within your body. Now, a lot of times I'm looking at a stool test for you. Now, these stool tests, if you're buying one of our programs, it is all included. But if you're not, then these stool tests usually are not super expensive. They're usually $450 if you don't have insurance, and if you do have insurance, it's usually just a copay. Sometimes that copay is $100, sometimes it's $150, but that's between you and your insurance. Once I get that stool test back, and if you go into some of my other lectures, I'll show you what that test looks like and I'll break it down in depth. We use that to create an individualized plan just for you. We're going to do diet, we're going to do lifestyle coaching, we'll do modifications within that, and we're going to do these on a very gradual approach. It's not like I'm going to tell you need to be a raw vegan overnight, although I did tell one person that and they did it for 3 weeks and they said it was the best thing they ever did, but that's beside the point. Then from there, we're going to see a transition and a move to health. You're going to feel better. You're going to absorb your nutrients better. You're going to get rid of those toxic foods that are irritating your body. You're going to heal the leaky gut, and then you can start eating those foods again. So our approach is very simple, and it works. Time and time again, it works, and you're going to start to notice better health because of it. So what happens? What symptoms are we looking for? We classify these as our big five. So this is going to be our weight gain, the fatigue, where you're just constantly tired all the time, depression, you're going to get hormone imbalances and digestive issues. Again, this all relates to the adrenal fatigue. Remember, I told you this is that triad. And within that triad, if one system is broken, whether that's our neuroendocrine or our GI or our detox pathways, everything is going to collapse. The whole system falls apart. So we want to make sure that's not the problem for you. And there are a lot of reasons why each of these come on. Weight gain. Well, one, your body is craving the carbohydrates, which we're going to talk about in depth in a little bit. Two, it messes with your thyroid function whenever we're having any adrenal fatigue or gut function, because there's this gut-brain axis that we're going to show you. There's another problem that goes on where you're craving carbohydrates because of a yeast overgrowth, and then you're gaining weight. The other problem is you get fatigue. This is because your little villi are no longer pulling in those nutrients that it needs. Instead, we're getting toxins into there, so you're not getting the adequate nutrition. On top of that, your body is working so hard to fight what's going on, it never has a chance to right itself. You get depression. A lot of this is because of nutrient imbalances. However, because of this gut-brain axis, you're getting imbalances within your serotonin and your dopamine levels as well, which is going to throw off the whole system. Hormone imbalances. Very, very common. We need a cascade to occur within the body for our hormones to work correctly. A lot of things are relying upon different cholesterols with the body, and then it needs to be broken down. We need to make sure that there's not an HPA or an HPT axis shift within the body that is causing these hormone imbalances as well, which is very common with issues with leaky gut. The other thing that can occur is these digestive issues. So starting to notice more and more bloating, more and more gas, more and more joint pain when you're waking up, more and more fatigue, more and more IBS symptoms, whether that's constipation or diarrhea or acid reflux even. You're going to notice more cramping, just feeling off. And so these are the symptoms that we want to fix in you. Now, what are the causes of this? And I just kind of went through this, but we're going to hit it again. So typically it's a breakdown in one of these key systems, so our hormonal system. This breakdown is caused by that increased cortisol, and I'm going to show you a case study on this, caused by emotional, dietary, and inflammatory problems within the body. Emotional. A lot of times I see this in women mainly, but it does happen in men. Women have a larger limbic system, so we tend to be a little bit more emotional. That's just the physiological aspects of it, and that's just how we are. But we tend to take on the weight of the world as a woman. We have all of this guilt that we harbor. We are mothers, we are wives, we are friends, we're sisters, we're daughters, we're employees, we're housekeepers. We have to juggle all of these things all the time. And a lot of times we do a really good job of juggling things. Our cortisol levels start to go up. We're able to balance all of these things. Our brain is functioning the way that it's supposed to in overdrive, and we feel on top of the world. But what happens is our body can only deal with that for so long before the bottom falls out, and then our cortisol levels start to drop, and then we can no longer juggle all those things. Now, emotional stress can also be caused by financial problems, whether that's in the home or at work. This can be by trauma, so you had a car accident, from the loss of a family member, a spouse, or a good friend. A lot of things can contribute to this emotional distress. Dietary and inflammation problems. This is those people that could be just eating pure garbage all the time. Or maybe it's a socioeconomic thing where you just don't have the money to go out and eat salmon and asparagus a couple times a week, which that's a whole nother soapbox for another day. It could be inflammatory problems where you're having joint pain, where you've been in a car accident and now you're having issues because of a broken bone, a broken ankle, a broken hip, and you're getting that inflammation within the body. Now, within the digestive system, another part of this triad, we have the breakdown from food intolerances and the presence of, or the prevalence of intestinal pathogens. So unfortunately, when our top part, our hormonal system starts to cave in, that's going to cause issues within the guts. The adrenal glands are going to control the guts. So now the guts are having problems driving out or grabbing the nutrients that they need. A lot of times we're eating a lot of garbage, so we're not getting that good microbiome back into our gut. When that happens, then we get an overgrowth of bacteria. Now, we need bacteria in our gut. We call these commensal bacteria. However, when the commensal bacteria start to grow out of range the way that they're supposed to, then they can become pathogenic. When they become pathogenic, then they eat up all the good bacteria so that they are the king of the field, and then you're going to get issues within there. And then finally, our detoxification systems. This is our liver. And I find that 9 times out of 10, when I am looking at our CMPs and looking at our transaminases, I can tell whether or not you have a detoxification issue. And this is breakdown from exposure of those environmental toxins within the body. Now, what are these triggers for these digestive problems? Again, that emotional stress. How we perceive an event rather than the event itself is the most important in generating that stress response. So if something triggers us, or we feel emotionally involved with a problem, and then all of a sudden we're thinking back, oh, well, this happened to me when I was a kid and I have all that trauma from there. All of a sudden our adrenal glands are going to realize that we have something off within our neurotransmitters. When that happens, it's going to start secreting catecholamines from the medulla, that inflammatory stress response. Those circulating catecholamines are so damaging to the body. I speak at cardiology conferences, and one of the things that we talk about is how circulating catecholamines can lead to heart failure, how this can lead to a heart attack, to Takotsubo, and these different kind of cardiomyopathies. And so we want to make sure that we are understanding how to deal with stress. Sometimes this is psychotherapy, sometimes this is getting in with my friend Christy over here at Flipside Psych so that we can help to balance these problems. Dietary stress. So unfortunately, those lovely little comfort foods like our donuts, our pastries, those simple carbohydrate ingestions leads to those rapid elevations in blood sugars, which ultimately leads to those up and down cascades of our glycemic index. Then we're getting this dysregulation with our insulin and our cortisol responses. And so our body's constantly trying to fight it. And then we get imbalances within here. Now, pain and hidden inflammation, again, this could be parasites in the gut, this can be bacteria, fungus, and typically these are our main sources of hidden inflammation. I really love working on hidden inflammation in the gut and fixing these problems because you feel amazing after this is done. So again, I alluded to that gut-brain connection. So the brain impacts the gut impacts the brain impacts the hormones impact the brain, and toxins impact everything. And so you can see how this gut-brain axis interplays within everything within the body. So it's very important that we understand that our gut is crazy important. I love the heart. The heart is one of my favorite organs. I can tell you everything about the heart upside down and backwards, but the more important organ within the body is truly the gut. Up to 70% of our immune system is housed within our gut. This is what's going to give us our nutrients to feed my favorite organ, that heart. It's what's going to help regulate things in the body. It's what's going to help with our neurotransmitters so we feel happy and healthy and wonderful. Now, there are some warning signs that tell us that the GI system is under stress and that we probably have an issue with it. So those IBS symptoms, so constipation, diarrhea, or an alternation of both of these, gas and bloating, foods that used to not bother you now are bothering you, starting to notice joint and muscle aches. You worked out and the next day you're like, wow, I shouldn't feel this achy. Anemia because we're not absorbing the iron the way that we're supposed to. Increasing in allergies resulting from that leaky gut, chronic fatigue, immune dysfunction. However, we have a classification of patients who have just become so accustomed that they don't have any symptoms at all. So I want you to take a look. This is an intestinal villus. So within the gut, we have these beautiful little villi, and you can see them up here in the top. They're all laid out, and you can see how they have a capillary and arterial network here that is going to be driving everything back into the bloodstream. We have a nerve fiber over here, and we have these beautiful little crypt glands. And this is a cross section of the actual intestinal villi here. So what happens is these beautiful little villi with these little bitty fingers on them reach up and grab the nutrients and pull them in through what we call a zonulin channel. And the idea is that it brings it through and it's going to give you the nutrients that you need. Goes directly into the bloodstream, into the body, out into circulation to keep you healthy, to keep you nourished, and to keep your body doing what it's supposed to. Now, these little cells also secrete mucus, which helps to move things through the GI system even better. This beautiful brush border, or these little villi, are so vitally important. However, if you have a lot of stress in your body, if you are taking a lot of ibuprofen, if you're eating poor foods, all of that, what happens is these beautiful little villi become diseased and we get something called atrophy or a breaking down of. And you can see we no longer have these beautiful large channels anymore where we can grab more nutrients and pull it into the body. Our channels become less and they don't work as well. What will happen is we'll start getting those little villi to shrink down. They no longer secrete the right amount of mucus. Sometimes they're putting out a lot of mucus, sometimes they're not. So that's when we're getting alternations of diarrhea and constipation. Because those little fingers can no longer grab the nutrients, it breaks apart those zonulin chains. So what happens then is you have food that's coming through. So let's say you had a turkey sandwich. So you have that gluten that's coming through. And as that gluten has been broken down, there's a molecule in it called gliadin. And that gliadin molecule is now going to go directly into the bloodstream. When it goes into the bloodstream, this is what the body is perceiving as a thyroid molecule. Because remember, gliadin looks almost identical to a thyroid molecule. All of a sudden, the body says, whoa, 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 Sparky, we've got a rogue thyroid cell here. So it starts creating thyroid peroxidase antibodies, or TPO antibodies. Antibodies are like the army, the warrior cells. So they go marching in to try to eat up this abnormal thyroid cell, which is actually a gliadin molecule. What happens is it begins to attack the thyroid, and we're having issues within the thyroid. So the body has mounted an immune response to that gliadin molecule because of the leaky gut, where it got into the bloodstream and it wasn't supposed to be there. This begins our IgG chain reaction of inflammation and allergies or food intolerances. Now, the same thing happens with dairy products. Dairy is very inflammatory. So we've got those breaks in those zonulin chains. So these dairy molecules come in, so our alpha or beta or casein, and it's going to go into the bloodstream. Instead of being passed over and the body grabbing the vitamin D and the calcium out of it, now we're getting the larger particles. The body sees this as a problem and it mounts an immune response against it, and now you can no longer eat dairy. Same thing with eggs, same thing with certain meats, same thing with our nightshade vegetables, so our tomatoes, our onions, our peppers, our garlic. All of these become inflammatory to the body. It's not that your throat is swelling shut, but your body is mounting an immune response against it because it is in the bloodstream instead of passing through the GI tract the way that it's supposed to. And in this final picture is the picture of sadness. This is now where we have subtotal villus atrophy, where you are just not going to be absorbing anything. The bad thing is this is a compounding and complex procedure. So the worse you feel, because now you're having joint pain because of the inflammation, because of the gluten that's breaking into those villi and getting into the bloodstream, you're going to take more ibuprofen. Ibuprofen kills off these cells. You're going to become more constipated. Constipated is going to wear down this. So now you're no longer able to absorb the nutrients the way that you're supposed to. It's going to compound this problem. So this is how malabsorption starts working within the body. Now, these are symptoms of leaky gut. You can see you get weight gain, autoimmune diseases, gas, bloating. Your allergies become worse because we're having an increase in the IgG responses. You're going to have unstable blood sugars, even if you're eating the best thing on earth. You're going to get sinus congestion, recurrent colds, and infection. I have a patient, I can't disclose too much information because she's pretty well known, but I have a patient who eats crazy healthy, who is super fit and works out wonderful. Looking at her diet and all of the things that she is doing correctly, you would see her and say, wow, she's a picture of health. But she came in and she confided in me, I just don't feel good. I feel toxic. I'm eating everything right, and for whatever reason I feel toxic. So we went down this path with her, and we started looking at her IgG food allergies, and she lit up just about every category in there. Of 287 different foods that I checked, she had reactions to, I think, close to 80 to 85 of them, and they were all in different categories. And so we went through and we explained what leaky gut was. And so what it was because she runs her own very large business, she has a lot of stresses in her life. And so what's happened is that stress, that emotional stress, has been breaking down the villi. And then she started getting issues with constipation, which she would try to fix with things like Miralax. And then she would get diarrhea, which she would need to take Imodium for to stop. And it was just this vicious cycle. Her blood sugar started becoming unregulated. Her thyroid markers, while still within a normal range, were not in that optimized area. So we realized that we were having some issues, complex issues within that triad. And so people who were doing everything right and saying, why do I feel like garbage? It could be because of leaky gut, and it's not your fault, and we can fix this. So what are some of those triggers associated with it? So lifestyle factors, diet, stress, sleep issues. If you're not sleeping right, your body can't heal. Exposure to toxic chemicals, poor exercise habits, and hormonal imbalance. And each of these will accelerate that damage. Gluten and dairy sensitivity, food allergies, secretory IgA or that inflammation response, immunosuppression, infection, surgery. These are things that can trigger that leaky gut. Now, what of our stages? It starts with that local GI symptoms, and they get worse and worse over time. As that intestinal lining begins to get broke down, those initial onsets are usually accompanied by food allergies. So now you're starting to eat a pineapple and you're feeling bloated and gassy afterwards. This is a very insidious process, and people often ignore it. Oh, it must have been something I ate. Oh, it was probably food poisoning. That's probably why I feel bad. Then they start getting sleep issues. They start getting more headaches, more muscle issues, more joint pain. And this is an autoimmune reaction. It's not lupus. It's not RA. It may be Hashimoto's at some point. But it's what's happening is the body is attacking itself, trying to get these toxins out of the bloodstream. However, eczema can be an issue, Hashimoto's, Crohn's, type 1 diabetes. And these occur as that antigen-antibody complexes build up and the body begins to attack itself. Now, we kind of talked pretty in depth about food allergies, but the problem is allergy leads to addiction and leads to those cravings. So allergies are often delayed allergies that'll show up as inflammation in the intestine after long periods of exposure. With these IgG responses, it can take up to 72 hours for you to have a response. So, let's say that I decided to eat a turkey sandwich and my gut is very mad at gluten right now. So I eat this at lunchtime today. I may notice more bloating, gas, stomach cramps, just pain, feeling kind of icky. It may happen right away. It may happen up to 72 hours later. So that's why those people are saying, I didn't eat the same thing. I've never had a problem. This morning I only had an apple and a banana and I'm feeling bad. Well, 3 days ago you might have had that turkey sandwich. The other problem with this, which becomes a little bit more complex, is once that gluten or that gliadin molecule gets into the bloodstream, that gliadin molecule can be in there for 3 to 4 months. So it can be causing damage within the body. So another thing to kind of keep in mind. Gluten. A lot of people have issues with gluten when they have leaky gut. It's not that you have celiac disease. It's not that you can never eat gluten again. It's just we have to heal your gut before we can do more gluten issues. So gluten is in wheat, rye, barley, and it causes a lot of digestive problems, and it's going to keep your body from being able to absorb your B12, your vitamin D, your antioxidants. It's going to keep you from being able to do conversion factors within your body, from lipids to cholesterol to pregnenolone to testosterone to estrogen. It's going to keep you from being able to switch over your different thyroid hormones because you're not getting enough selenium, zinc, or iodine. So gluten is very irritating to the body, as is sugar. So sugar is a drug. It is a poor man's heroin. It is as powerful as Valium, alcohol, or marijuana. Sugar is very, very addicting. Now, a food addiction is a chemical addiction, not just a behavioral problem. It is a chronic disease that won't go away. Compulsive eating tends to run in families, and the food is the most readily available drug. Obesity is a symptom, but it is not the disease. And unfortunately, the level of humiliation around addiction is stronger than that with alcohol. And a lot of people are very embarrassed. They don't want to seek help. They don't want to, come into the office and say, hey, I think I have a problem with sugar. Because one, the addiction is so strong that their body's saying, if you tell somebody you have a sugar addiction, you're going to have to get rid of the sugar. But the other problem with this is that they feel embarrassed by it. They feel like, why can't I control this? But this is a disease. It is a problem, and we can help with this. We can address these issues. So what is the chemistry of addiction? So we have these gluteomorphines that are morphine-like compounds that break down from gluten. These trigger that feel-good reaction in the brain and create addiction to the very foods that patients are sensitive to. This is why we most often crave the foods that are harming us. So it's kind of like that, it's a comfort food. So, I want Mama's biscuits and gravy. My mama makes the best biscuits and gravy, by the way. Oh, I want Mama's biscuits and gravy. And that's because these gluteomorphines are working like morphine-induced. It gives us that high, that euphoria that we're looking for. Eating disorders. Oh, goodness. We could spend another 5 days talking about different eating disorders and disordered eating and the complexities around that. But anorexia, bulimia, and overeating are all the same disease of food dependence. Being an addict is not a moral problem. It's a chemical imbalance in an addictive disease. Before you can uncover any of the pain of maladaptive food behaviors, you have to deal first with a physical and biochemical solution. So that's what we need to do. We need to find out how you got into this disordered eating and fix it. So this is from Lynn Elliott Harding, and she defines food addiction as the chemical dependency disease, not as a behavioral or a lack of self-control. It's not your fault. It is not your fault. It is not your fault. So these chemical properties of certain foods can cause irrational behavior, depression. It can often have issues of prolonging the disease of chemical reactions as well in this chemical addiction. And so we need to be able to break these food addictions. Food dependence. Adrenal stress is another result of that food dependence. And again, that comes within our triad of that neurohormonal or the neuroendocrine system. Food dependence can lead to a compromised immune system because we're not able to absorb the nutrients that we need. Serotonin suppresses carbohydrate cravings, so low serotonin levels are associated with more carbohydrate cravings. So the sadder you are or the more depressed you are, the more you're going to crave the carbs. Unfortunately, the more you crave the carbs, the more it's going to push down the serotonin, so then it's this vicious cycle that goes around and around. If the digestive system is not getting the nutrients to all the other systems, then all the physical, emotional, and mental functions are in danger. It breaks down every system. Willpower is just not enough. So what we need to do is we need to treat this food addiction as the disease that it is. And we need to get to a cure. So we need to diagnose and we need to treat. We need emotional support. We need spiritual recovery. And you know that I'm very, very big on that. People tend to have negative opinions of fat people. And I find that is just very, very sad to me. It's assumed that fat people are lazy and undisciplined. That's not the case. There is the disease. Now, if someone comes in here and they have a cancer, depending on the type, I guess we could say, well, it was caused by this and this is your fault. But for the most part, it's an abnormal growth of cells. It is a disease. It is not the fault of the person. It's the fault of the chemistry and the engineering within the body. So, it's not that they are lazy or undisciplined. It's that they have a problem, a disease, a pathogen, a disordered way of their body working. So we need to fix that. A fat person may be an addict, and dieting only makes us sicker. That's why when we get you in here on our weight loss programs, a lot of people are surprised when they're getting the videos every week or meeting with our nutrition counselor that we're talking about how are you sleeping. This is ways that we want you to sleep. Do you know how to relax? Do you know how to do grounding? Do you know how to detoxify the body? They don't understand that it's not just about the food. It's about treating the person as a whole and getting to a better lifestyle and a better level of health. It's not just willpower. It's not just being lazy or undisciplined. It's teaching you how to live healthy, because we don't want you to diet. We want you to have a healthy lifestyle. Now, I talked about sugar and yeast. Candida infections, yeast infections in your digestive system will cause uncontrolled eating. Sugar is going to be taking nutrients out of your body. When the adrenal glands are assaulted by the sugar, the immune system is compromised and the craving cycle continues. It's that vicious cycle all the way down. So what does Candida look like if you have an overgrowth of Candida? A lot of times you're going to notice that white coating on your tongue. So when you get up and you do tongue scraping, you're going to notice a thicker coat. You're going to have more fatigue. You're going to have those itchy, burning eyes. You're going to have more mouth sores. You may get weird rashes and skin itching. You may have genital issues. You may have more bloating, constipation, diarrhea. There's a pretty easy saliva test that you can do at home to measure how much yeast is in your body. I'll give you the brief overview. You get your cup of water, you set it next to your bed. It needs to be in a glass so you can see. And first thing in the morning when you get up, you're going to spit into that glass. You don't need a hakaluki or anything like that. Just spit into the glass. And you're going to look at the spittle and see if it starts to either go all the way to the bottom or create long fingers. You can Google this test and see what your results are looking for, but this is an easy way to see if you have a yeast overgrowth in your body. Pathogens and toxins. These are other things that can cause problems. Pathogens can cause problems because you can't heal your gut until all the GI infections are eliminated. Now, when I do those Genova stool tests on you, we're able to see all of the pathogens. We can see good bacteria, bad bacteria. We can see protozoa. We can see parasites. We can see the different toxin exposures within the gut. Sometimes I am doing a round of antibiotics, which, you know, I'm not a super fan of antibiotics, but sometimes I'm doing a round of antibiotics and then I have to chase the yeast afterwards. Sometimes I can do this with an herbal killing program where I can kill off those pathogens pretty quickly and readily without causing any damage, and will actually strengthen your immune system. Environmental toxins impact you daily, and a lot of people do not realize that. So the air that you're breathing in, the water that you're drinking, the plastic water bottle that you're drinking out of, plug-ins that go into your walls, burning candles, being around cigarette smoke, eating garbage food like McDonald's, Taco Bell, any of those fast foods that are highly processed, even certain chips and cakes and candies. These can all have toxins within them and cause issues within your body. Both of these things are going to deplete those brain chemicals and they trigger overeating. So it's going to depress that serotonin. So you're going to start craving more carbohydrates. Now I'm going to show you some things here with these protozoa and yeast. So I'm going to start over here. This is a patient of mine. This is a functional adrenal stress profile. So my patient is down here across the bottom in yellow. And so these are actually based off of stage 1, stage 2, and stage 3 of adrenal failure or adrenal fatigue. So in the morning, when you first rise, your cortisol level when the sun hits your face should be about a 20 to 25. So it should be more up in this range. Now you can see she is down here at a 3.9. Now at night, when you get ready to go to bed, remember that cortisol comes up and it drops off very, very slowly until nighttime when melatonin picks over. You need to be about a 2. So at night, you can see she's sitting at a 1. However, she's pretty much flatlined throughout the course of the day. No energy whatsoever. So then we looked at a GI screen on her. And so what we've got here is we've got a protozoa. And the protozoa that we have is Blastocystis hominis. And we have a light growth of yeast going on here. So what we need to do is we need to treat this because this patient is in stage 3 of adrenal fatigue. Stage 1 is where, you know, you're doing what you're supposed to, you're just starting to feel off. Stage 2 is where you're juggling all those hats and you're like, yeah, I've got energy for days, I can think this through, and your body is trying to overwork to help produce enough cortisol that you were able to get through the day. And stage 3 is where the bottom falls out and you flatlined across. So again, this Blastocystis hominis is what has caused the issue. Now we're getting an overgrowth of that yeast, and it's only contributing to this stage of stage 3 adrenal fatigue even more. So what's our solution for this patient? we need to reduce the inflammation through the diet and lifestyle changes. So we also looked at one of those IgG tests on her, and we looked at 287 different food choices. We removed those from the diet, and we also put her on an elimination diet. Then what we want to do is we want to strengthen that secretory IgA levels through those adrenal protocols. So with this patient, we actually put her on pregnenolone and we put her on DHEA for a short amount of time. We boosted a couple things within her body, and we gave her some other herbals that'll help boost the cortisol a little bit more naturally, and we did a lot of antioxidants on her. We also have to kill the bugs in the GI tract. So I actually put her on a parasite killing program that'll also work towards yeast. So this herbal formula, she's just going to take for about a month and a half, and then we're going to start adding in good probiotics and add in more pre and probiotic foods. And this is going to help her body overall. Now, if you have any questions about this, or if you're like, you know what, I feel like a lot of these symptoms are me, it's like looking in a mirror, you can let us know. Even if you are halfway across the country, I can send these test kits to your house. You can do these tests at your house, and we can get in and do a telehealth visit on you, and we can figure out what is going on within your body. We can work to fix the problem and make you a healthier, happier version of yourself. If you have any questions, you know how to get a hold of us. You can reach out to us by our email, which is info@empoweringhealthspa.com, or you can get on our website at empoweringhealthspa.com, or you can give us a call, 812-290-2128, and I hope you have a lovely, healthy, beautiful day.